Good evening, everyone. Today we are here to discuss about sleep apnea awareness with Dr. Suma. So, Dr. Suma is medical director at Excel Care Hospital and a consultant pulmonologist. And Madam has done her MBBS from BMCRI Bangalore and MD Pulmonary Medicine from University of Glasgow, UK. And she has got European diploma in respiratory medicine. Currently, she is practicing in Excel Care Hospital, Bangalore. So, Dr. Suma will be sharing some useful insights on sleep apnea. Hello, ma'am. Welcome to the session.
Thank you very much. Thank you for the kind introduction. I'm very glad to be here.
Thank you, ma'am. So, over to you, ma'am. My first question would be like, what is sleep apnea for our patients to have to the general public? What is sleep apnea?
Sleep apnea is a condition where there is some obstruction to breathing that usually happens when you're asleep and mostly in the night. So this is a condition where we all assume that as we age we snore, and that's pretty common. People sort of say, oh, he sleeps very deeply because he snores. So that's not really always true. So snoring may be a precursor to obstructive sleep apnea. So this is where in snoring we do see increased vibration in the back of the throat. In obstructive sleep apnea, the airway closes completely and the resultant dip in the oxygen level makes the brain wakier. Patients may not always wake up completely, so they are aware of this problem. They may just go from a very deep sleep to light sleep. But they wake up feeling very unrefreshed. So obstructed breathing, unrefreshed sleep, and so they are more sleepy during the daytime. They are trying to catch up sleep that they have lost at night. So that's obstructive sleep apnea.
And could you please throw some light on central sleep apnea?
Yeah, central sleep apnea is a condition where even the brain goes to sleep, as we put it. So there is some problem with the brain per se, or the heart conditions like chronic heart failure patients, where the obstruction is happening but not at the level of the throat. The central signal that has to reach our breathing muscles, our upper airway, and those things get affected due to various brain disorders and heart failure conditions, and that we call as central sleep apnea. So it is quite a distinct entity from obstructive sleep apnea that we discussed before, but in some patients, especially in cardiac patients, the two may coexist also. So it's very important to be aware of this association.
Right, ma'am. And what are the warning signs for sleep apnea or symptoms that patients?
That's a good question. So anybody with snoring and apneas, that is obstructed breathing, if somebody has witnessed their partners waking up with choking spells at night like this, then they should be thinking of this, especially if they've had irregular breathing pattern. They notice their partner is stopping breathing and then restarting with a grunt. All these things could be indicators of apneas. And during the day, they may be waking up with low energy, unrefreshed sleep, and trying to fall off and get some extra sleep during meetings, etc. So if you're seeing your family members dozing off more than usual in front of the television, or in offices if you're dozing off in the afternoons, definitely do think of your sleep.
Thank you. And what may be the risk factors for sleep apnea, ma'am?
Obesity is a strong risk factor for obstructive sleep apnea. Having said that, about 50% of people may not be very obese or overweight at all. So it is what we are born with. If we are born with a very receding chin, very narrow upper airway, lots of fat around the neck, so many things like that can contribute to obstructive sleep apnea. Patients with low thyroid status, that is hypothyroidism, are also at increased risk of developing obstructive sleep apnea, so it's worth being aware of it.
Okay, right. And just want to understand from you, ma'am, in the pediatric population, how this sleep apnea is diagnosed, because they don't consume alcohol, or they are not in the risk factors, whatever you mentioned. How it is diagnosed in pediatrics?
So again, a lot of this grunting, irregular respiration and things might have been noticed by the family, and they may be bringing for evaluation. Many a time in children, it is related to, apart from all those facial abnormalities I was discussing, it may also be related to hugely enlarged tonsils and adenoids. So in an adult sleep apneic, if it is diagnosed, we do use a machine called as continuous positive airway therapy or a PAP therapy that many people may be aware of with their families and friends using it. However, in children, a lot of the time it is related to these enlarged tonsils and adenoids, and removing those may have a definitive benefit, and they may not require any further treatment apart from removal of these. So pediatric obstructive sleep apnea is very different to the adults, and it has to be evaluated thoroughly by itself and treated.
So, in your regular daily practice, so patients come with sleep apnea and you suggest them about some sleep studies, some medications or some treatment. So, how far these patients overcome this sleep apnea? And is it
Sleep apnea is a very common condition. So if we do a sleep lab and we can even incidentally identify about 15% of patients having this sleep apnea that we record on the graphs and things like that. If we look at the actual data, it is said that symptomatic sleep apnea, like I was telling you about them having daytime symptoms, all that, it is said that up to 10 to 15% of people in middle age may be suffering from it. So it's quite a big number. But people approaching, sleep labs, their doctors, physicians, pulmonologists, sleep physicians, it is said maybe about 4% of women and 8% of men we may be diagnosing this obstructive sleep apnea, treating them, etc. So certainly there is no tablet that cures obstructive sleep apnea. Initially we do a sleep study which can either be done in a sleep lab, which entails a lot of monitoring including the brain activity, etc. So many people may not be very willing to come and get this evaluated. However, these days very portable monitors are there wherein home studies can also be done. They sleep with very small monitors on their hand and a little band on their chest, and they can just download the data in the morning, and we will be able to tell them whether they have the problem or not. And if they have it at the severe end of the spectrum, or if they are very simple, certainly many of our sleep apnea patients will concede that when they were driving at some point, they had the tendency to doze off, or when they stopped at a traffic light, they were dozing off, and somebody had to honk to them to wake them up and things like that. So it does exist in our country too. So certainly that is a major issue to worry about. And secondly, in a single person, obviously in that individual patient, you may have a lot of disrupted quality of life. So you're having not slept well, and daytime consequences, irritability, mood disturbances, all these things can be accompanying poor quality of life. And more than that, over time, the repeated dips in the oxygen levels at night that happens can have a lot of problem and effect on various organs of the body from head to toe. For instance, in the heart, it can go on increasing the right-sided heart pressure, what we call as pulmonary hypertension, and eventually from these recurrent episodes of low oxygen and buildup of carbon dioxide, a condition called as decompensated respiratory failure, where there is fluid overload, low oxygen, high waste gas, carbon dioxide peaks, all these things can happen. Certainly we do see in sleep apneics poorer control of hypertension, and impaired glucose tolerance or insulin resistance can be more heightened in these group of patients. So these are some of the serious side effects that we do come across, thereby increasing the risk of heart issues, strokes, etc.
Thank you so much, ma'am. It's really a valuable information that you shared with us. So you mentioned about obesity as a major risk factor. So I would like to understand, because obesity is again linked with diabetes and hypertension. So is there any prevalence of these two?
The metabolic syndrome, where it is all connected to each other with the increased cholesterol, dyslipidemia, and all that. Certainly, obstructive sleep apnea also fits into that syndrome Z, where these things all can coexist and cause poorer quality of life. Yes, and we do see invariably treating sleep apnea entails that their BP medicines can even be reduced in some people. Their blood pressure comes under better control. Where sugars were really impossible to control, they can come under better control. They can end up reducing the dose of insulin, for instance, that they require on a regular basis. So all these benefits can be seen in sleep apnea when it's well treated.
Right. Thank you so much for your useful insights on sleep apnea, ma'am. So finally, I would like to, being an eminent pulmonologist in Bangalore, so what preventive care you advise to your patients who come with sleep apnea?
Prevention of obstructive sleep apnea, that is somewhere we are going now. That's not an easy task at all. First of all, raising awareness about this condition, because we do see many people who we are very certain have barn door obstructive sleep apnea, but when you broach up this subject, they invariably say, no, I have absolutely no problem with my sleep.
Right.
So raising the general awareness amongst the public and family members to notice about these things is very crucial. Increasingly, people are not as reluctant as they were to use CPAP, carry their machine abroad when they're traveling, etc. So raising awareness and ensuring you get the diagnosis and get the appropriate treatment in a timely fashion is very crucial for this condition to prevent complications and implications on other systems.
Thank you so much, ma'am. And what are the current treatments available?
Like I was saying, the sleep apnea, which is basically sleep apnea is treated with the CPAP, which is basically you have a positive pressure that is blown through a little machine which is kept by the bedside, connected by a tubing to a mask which is fitted on the face, so that the airway is kept open during night. So it's a mechanical problem where the airway is collapsing, you're splinting the airway to ensure that it is not collapsing. It's as simple as that. But obviously it's not as easy as taking a tablet. Most people would ask me, is there no tablet replacement? We all seem to be very used to taking tablets but not having some direct treatment. So also in the long run, obviously because of because of the external measure that we have to use for it, many people do tail off taking these machines when it can also be very useful to them. So understanding about this treatment, educating them the right way is very crucial when we initiate these patients on CPAP therapy. But those who get the benefit will swear by it and use it for life without any problem.
One last question, ma'am. I just struck my mind actually. So is this particular sleep apnea, it's a curable or a treatable one?
So I have to be careful here, isn't it? Viewers may get worried about it. So if people do not lose weight, which is very difficult thing after 40 years.
Exactly.
So it may be a lifelong thing in the majority. Okay? If they manage to lose weight, if they're super obese, for instance, they get a surgery, obesity surgery, and then lose a lot of weight, then there is a very good chance of coming off a CPAP machine. Okay? In most people, I say that if you lose 10% of your body weight and you become super fit, good, and start doing regular exercises, eating healthy diet, then you come back to us, we evaluate whether the severity of your sleep apnea has come to a level, come down, and whether we can take you off CPAP. So it's not very common, but 1 or 2 patients really will persevere in a year and come off CPAP very effectively. So there are more number of patients coming off CPAP thinking it's a cumbersome treatment than somebody whom I say your sleep apnea is now cured and you can come off it.
Thank you so much, ma'am. Thank you so much for your time and giving us really a wonderful thoughts about sleep apnea.
Thank you very much, and thanks to Sanrai for organizing an education a meeting like this, and really thankful to the 24/7 support we get with respect to CPAP, BiPAP machines, oxygen, etc. Thank you.
Thank you so much, ma'am.